Good afternoon, I'm Giovanni Dennis with the Midday News. A special welcome if you're joining us online at onespotmedia.com. Yet another record-breaking daily tally. 403 confirmed cases of the coronavirus were recorded in Jamaica on Monday. This is the highest number of confirmed COVID-19 cases since the virus was first detected in March last year. 1,935 samples were tested on Monday. The country's case count is now 17,701. Their ages range from 63 days to 96 years. Manchester recorded most of the cases with 81, followed by St. James with 69. Meanwhile, an 84-year-old man from Kingston and St. Andrew is the latest to die from the respiratory illness. The country's death toll is now 359. Meanwhile, the Manchester Health Services says it's intensifying its fight against COVID-19 in the parish. In a release, parish manager for the Manchester Health Services, Sunday Chambers Ferguson, said the health team has been going to high-risk communities to test residents and conduct sensitization sessions. And anticipation is building whether tougher COVID-19 measures will be announced today by Prime Minister Andrew Holness during the sitting of the House of Representatives. The country has recorded 6 straight days of high positive results, which healthcare professionals have blamed on Jamaicans flouting the protocols. More people have also been hospitalized, resulting in bed spaces nearing capacity. The matter was discussed by Cabinet on Monday. Now, Health Minister Dr. Christopher Tufton told our news centre this morning that Prime Minister Andrew Holness is expected to speak to the increased numbers in Parliament today.
The Prime Minister will speak to Parliament today, and I'm sure he will speak to the issues around the numbers and where we, reflect some of the concerns that the Cabinet would have discussed last night. But clearly, as I have said, the numbers are of concern, and so it's an issue of how we pull back to control as best as possible any further increases.
No, Dr. Tufton declined to say whether the health team recommended more restrictive measures to the Cabinet. Opposition spokesman on health, Dr. Maurice Guy, says the high number of COVID-19 numbers are reflective of the increased testing capacity in the country. Persons have the option of doing a PCR or antigen test. There are also more locations offering tests. The Jamaica Teachers Association is eagerly awaiting the presentation by Prime Minister Andrew Holness in the Parliament this afternoon. President of the association, Jasford Gabriel, has been calling for an end to face-to-face classes since the island started to record a significant spike in COVID-19 figures last week. OSHANE Masters has the details.
Numerous calls, including from the JTA, have come for the education sector to return to online teaching. But it was flatly tossed aside by Education Minister Favour Williams on Monday. Today, the nation recorded its largest number of cases in one day, but within the last 10 days, the country has recorded more than 2,000 cases. The JTA president believes it's time for face-to-face classes to end. It's why he's looking towards the Prime Minister's presentation in Parliament today. Are you saying then that you're expecting the Prime Minister to be saying, okay, with the increase in the number of cases, let's return to online classes?
That's not a reasonable and logical explanation, unless, like I said before, a definitive explanation can be offered that the opening of schools has had no impact in terms of the cases that are spiraling out of control. Our students are traveling across several communities and engaged in all sorts of activities, and we're having more and more schools closing.
He says the risk ranking mechanism, which was suggested would be used to determine if face-to-face classes should continue, has seemingly been discarded by the Education Ministry.
Clearly, with the numbers that we are seeing, it would suggest that under that kind of approach, we would have pulled back. We still have over 400 schools that have been approved to open. Last week, when we had almost 600 cases in 2 days, the expectation would have been for the Ministry of Education, Youth and Information to come out with some kind of statement given the risk ranking approach that we have been using, and nothing has been said.
He says the trend is worrying and calls for concern in the education sector.
Up to today, I got calls early this morning of cases in some schools. We have teachers who are showing symptoms of the COVID-19 and are unable to get tested because of the pressures that the health services are under and the quotas that they are working with on a daily basis. And so the numbers are not surprising. They are going to continue to spiral out of control unless we take drastic measures to bring some semblance of normality to the system.
Mr. Gabriel says the number of schools with cases of COVID-19 is much more than the 8 reported so far. In the meantime, the JTA president says the matter will again be raised with Education Minister Favour Williams on Wednesday at the Education Ministry and JTA's monthly meeting. OSHANE Masters, TVJ News.
Meanwhile, the National Parent Teachers Association of Jamaica has joined the campaign calling for the cancellation of face-to-face classes in public schools. The association is also pushing for the non-resumption of team sports, including boys and girls championships. In a press release immediate past, President of the association, Everton Hannam, argues that based on the record spike in COVID-19 cases being reported over the past few days, all opportunities for further spread should be minimized. It's why the association believes face-to-face classes and all school sports should be postponed until the numbers are reduced. The Jamaica Teachers Association made the recommendation this week following a worrying rise in reported positive cases. And we now take a break here on the Midday News, but please stay with us. We'll have much more when we return. Welcome back, and we're continuing the news. There are mixed reactions from teachers about the Ministry of Health's decision not to include them in the priority groups to be immunized against COVID-19. Former president of the Association of Principals and Vice Principals, Linton Ware, says he's been receiving feedback from teachers and principals across the island. Sandy Williams reports.
Last week, head of the School of Public Health and Health Technology at UTech, Professor Winston Davidson, called for teachers to be included in the priority groups for vaccination against COVID-19. Professor Davidson reasoned that, based on the interaction with students during face-to-face sessions, teachers faced elevated risk levels. But in response to the call, on Monday, Health Minister Dr. Christopher Tufton said the teachers will not be among the first batch to receive the jab. He insisted that the focus will be on frontline workers when vaccination begins.
The truth is, our teachers are very important, but our nurses and doctors on the front line, or the policemen and the soldiers who enforce the quarantine arrangements and so on, are more important in the scheme of things at this point in time. So we can't put the teachers before them, and I wouldn't recommend putting the teachers equal to them. But that is not to say they are not a priority. It's a function of how quickly we can get the vaccines, and we will move down the line with teachers being a prominent group, but in the first case, not the priority group.
Former president of the Association of Principals and Vice Principals, Linton Ware, says there's been mixed reaction from teachers and principals about the minister's response. He says some teachers want to be included in the priority groups for vaccination.
Those that communicate that they should be in the first set, they made mention of a number of things. They made mention of the fact that they have quite a number of students that they will have to interface with. And with the number of students that they will have to interface with, these different students are coming from different communities, which means that the teachers see themselves at risk.
But he argued others are satisfied with the health minister's decision, but only because of fear.
They made mention that they would want to see other individuals being treated with the vaccination, because you see, I'm getting from those who made mention that they should not be at the front of the list is because of fear. So these are some of the things that are out there. So it's a mixed reaction from both groups.
The health ministry is making preparations to begin vaccinating Jamaicans against COVID-19 this month. Dr. Tufton told the House of Representatives last week that Jamaica is to receive its first doses of the AstraZeneca vaccine in 2 weeks instead of the initially projected April date. Sandy Williams, TVJ News.
Meanwhile, officials from the World Health Organization say initial findings from their investigations in Wuhan, China, suggests an intermediary host species and frozen food transmission are the most likely ways COVID-19 was introduced to humans. More from the CNN.
The findings from a long-awaited investigation in Wuhan to the origins of COVID-19 say that further research is needed. A team of World Health Organization experts say that the virus most likely jumped to humans through an intermediary species. Other possibilities include through frozen goods or direct transmission from animals to humans. They say a lab-related accident is extremely unlikely. The experts visited the Wuhan Institute of Virology, which former President Trump had claimed, without evidence, is where the virus had escaped from. The team also visited hospitals, labs, and markets, including the now famous Huanan Seafood Market. The experts say that the market may not be where COVID-19 initially spread from, as was widely believed. They did not find evidence of large COVID-19 outbreaks before cases were officially recorded in December 2019. But they did find evidence of wider COVID-19 circulation outside of the Huanan market that same month. The experts call this a work in progress. To put this all into perspective, it took more than a decade to find the origins of SARS, while the origins of Ebola, which were first identified in the 1970s, are still unknown.
The Ministry of Agriculture says it's trying to source additional storage space for farmers to preserve their produce. Agriculture Minister FLOYD Green made the disclosure in St. Anne recently. Mr. Green says COVID-19 has showed the harsh reality of lack of storage across the island. He says this has caused many farmers to suffer losses due to spoilage.
And as such, we have known it for a long time. We go through these periods of gluts and then shortages, which are really because of an inability to adequately store our agricultural produce. And as such, the ministry is going to be embarking with our international partners on a drive to put in appropriate storage mechanisms across the country to help us better treat with times of glut so that we can eliminate times of shortage.
Mr. Green says the ministry's aim is to develop a modern agricultural sector that is market-driven, research-based, and is also sustainable. The Agriculture Minister noted that going forward, a team of experts, including the Met Office, will be involved in decision-making so they can plan better for things such as weather patterns.
So, for example, we have convened the disaster risk management and mitigation committees. The Ministry of Agriculture has pulled together a committee of that nature. And the reason why we have done that is because we have seen that time and time again, weather events are the biggest threat to agricultural sustainability. And while you cannot necessarily determine when these weather events will happen, our world has done a much better job at forecasting. And if you can forecast, then you can prepare.
Confusion this morning at the Kingston Public Hospital after patients showed up to the facility and having to wait hours before operations started. With lines growing even longer and no updates, patients started to get frustrated. Some have traveled from far to do scheduled surgeries and have been waiting from as early as 4 a.m.
To access outlets and to be out of the home space or in different environments.
And I come this morning to have a surgery on my mouth, so I don't know what is going on. And it's the first time I ever come here and see this, so I don't know. But a nurse come and take my card for morning, and I don't hear back anything as yet.
It's a chaos in there, and we don't know what is happening. And we are just standing out here and looking. Don't know what to do. No one come out and say anything, so we are just have to wait. And we don't know the situation that is happening in there.
It's not known whether hospital staff withdrew services earlier in the morning, but according to one patient, there were some issues with nurses.
As I reach, I ask what really are going on, you know? yeah, you know. And the security, I say, like, some nurses strike and such, so. Just I work with me here still. I don't really know what really going on, really, you know.
Now our news team tried to get in contact with the KPH CEO, Berknell Stewart, but was told he was in a meeting. Experts are concerned that children who have suicidal tendencies are at greater risk during this period of online learning. Children who may have suicidal thoughts are more likely to go unnoticed because teachers are less able to detect change in behavior during online learning. This comes in the wake of the latest incident in Brownsall, where a 16-year-old boy took his own life 3 weeks ago. Children's advocate Diane Gordon Harrison is of the view that Jamaica has had a strong history of violence against children. She said that children who suffer from suicidal tendencies usually use the schools as a sort of solace.
The inability to access outlets and to be out of the home space or in different environments where they're with their peers or with professionals who are observing certain changes would impact on the outlets and the impact, therefore, on children who may be suffering in the spaces that they're confined to.
Ms. Gordon Harrison also said the use of words in a negative way can impact the self-esteem of a child. She adds that there are instances where a child may act out in pursuit of attention, which could lead to fatality. Now, it's the reason she wants parents to take note of the changes in behavior.
If there's a child who's usually very quiet and not very expressive, but, quietly doing their thing, all of a sudden becomes very talkative and very extroverted and, precocious, then that may be a sign as well to us as parents that something happened to trigger this kind of reaction.
To news overseas, Senate leaders have reached a deal on how they will structure former President Trump's impeachment trial. A vote will begin the historic proceedings. More from the CNN.
All parties have agreed to a structure that will ensure a fair and honest Senate impeachment trial of the former president.
With an agreement on the rules, the Senate is set to begin its second impeachment trial of former President Donald Trump.
It preserves due process and the rights of both sides.
Under the deal, House impeachment managers and the Trump defense team will each receive 16 hours to make their case around the charge of incitement of insurrection as a result of the riot at the Capitol on January 6th. House managers can also call for a vote on witnesses if they choose. In a filing Monday, Trump's defense team described the trial as unconstitutional now that their client has left office and sought to distance his behavior from the insurrection, saying in part, "The real truth is that the people who criminally breached the Capitol did so of their own accord and for their own reasons, and they are being criminally prosecuted." House impeachment managers seeking to draw a direct line between Trump's rhetoric on January 6th and the violence that ensued.
We fight like hell.
That argument already playing out in the court cases of those charged in the riots.
And that's the Midday News. I'm Giovanni Dennis. Join us at 7 for Primetime News. On behalf of the news, sports and production teams, have a good afternoon.